You ready, Adriana?
Yes, ready to go. I think Ben just needs to formally get the county channel process underway. There's a countdown effort that happens.
Stand by 1 sec. All right, Jim, if you can hear us, we can do a countdown. 5, 4, 3, 2, and 1.
All right, good evening, everyone. We're ready to launch tonight. Welcome to the September 22nd meeting of the Community Recovery Advisory Group. My name is Adriana Hochberg from the County Executive's Office. I would like to turn things over to our chair, Elijah Wheeler.
Thanks, Adriana. Good evening, everyone. Hope that you are well this evening. As Adriana stated, welcome, to the CRAG, Community Recovery Advisory Group, which consists of you all, representatives from a spectrum of communities, populations, issue areas, and institutions that are currently being impacted by the COVID pandemic. Once again, this group will advise the county executive and county council on the needs of the community in recovery from COVID and how the county can achieve a new normal that is more equitable than prior to the pandemic. During the course of the evening, we would ask that if you have any statements or comments that you'd like to make, to enter those into the chat below or the Q&A section. I will also be scanning the screen to look for people who physically raise their hand during the course of the conversation. We are going over 2 items this evening. The first, internet broadband access with our guest Donna Keating from the Department of Technology Services. The second item will be COVID testing with Dr. Raymond Kroll for the second half of our meeting this evening. Looking forward to the conversation. We hope that it's rich. And I will now turn it over to Dr. Earl Stoddard.
Good evening, everyone. Welcome back to our Community Recovery Advisory Group. I only want to touch on a couple things today. As many of you will have seen, County Council acted on the County Executive's updated executive order today. We are expanding some of the capacity in our house of worship. This was something that was has been sought, particularly as we had just had Rosh Hashanah. We have Yom Kippur coming up in a couple of weeks, as well as a number of other high holidays and high holy days over the next several months. And so what we aim to do is work with the faith community to develop an expanded capacity that was offsetting some of those risks by having some additional recommendations and requirements in other areas for houses of worship that allowed for things like the entrances and exits to be more closely monitored and have physical distancing and face coverings be worn in those as well. And so it's just sort of around the edges, we can make small differences that will allow to offset some of the risk of increasing the capacity inside the facility. We're also working on a proposal for our restaurants. I know some of them have been deeply impacted by the 10 o'clock alcohol sale limitation. Obviously, we've seen benefits from both a number of complaints, enforcement, and frankly, in some of our metrics that suggest that has largely worked, but it has impacted those businesses. And so we're trying to figure if we can do some sort of opt-in program that will allow them to get back to doing those sales under a more stringent set of guidelines, where the penalty then becomes loss of your license and potentially other more significant remedies than the traditional ones that we have available to us under other circumstances. And so we continue to work on that. We also are working very closely with Montgomery County Public Schools, as well as our non-public schools, on the reopening activities that for our non-publics, they've already started some hybrid depending on the school. And we want to make sure that they can continue to do those as safely as they can be made. And obviously, Montgomery County Public Schools is looking to begin some opportunities potentially as early as the second quarter. Obviously, there's a lot of details to work through that they're working through, but we are obviously supporting them in the endeavor to try and, particularly as it relates to special education, ESOL and other students have opportunities that can have some in-person capacity or in-person ability, depending on the model and how it's done. up to and including, things like testing of staff and employees and things like that. So lots going on those fronts. I know that they've got a lot of work to do before they're ready to really talk about it. And obviously they've got to work through things with the teachers and other staff to get them comfortable with the proposal as well. And so there's still be work on. We're supporting them in that effort. So that's all I have today.
Okay, Elijah, am I on?
Yeah, I was just trying to unmute myself. I'm sorry about that.
No worries, no
Good
worries. I
evening.
understand.
No
So,
problem.
good evening. I'm Donna Keating with the Department of Technology Services, also known as DTS in the Office of Broadband Programs. Thank you for the opportunity to talk with Craig, the Community Recovery Advisory Group, about the county's broadband initiative spearheaded by DTS. Digital equity, as you know, is defined as the ability where all individuals in a society can access the technology needed to fully participate in our society, democracy, and economy. The county wants all people to be able to participate in the digital economy and have the education to access the necessary tools, whether it's a computer or a smartphone. The Office of Broadband Programs is taking steps towards achieving digital equity for all in Montgomery County. For the goal is for all people to have access to affordable home internet, and also the skills necessary to use the internet confidently for daily living. This is being accomplished through programs that are designed to expand broadband services, educate residents, including seniors, and aid individuals in connecting to the internet. We have several education and awareness programs. Ultra Montgomery. Ultra Montgomery is a broadband economic development program. Ultra Montgomery supports cost-effective, competitive access to robust, reliable, and secure broadband services and ultra-speed high networks for businesses throughout the county. This program also works to ensure that all residents and businesses have access to the digital economy. We're also working on several education and awareness programs concerning low-cost internet for low-income residents. Senior Planet Montgomery. In 2016, Ultra Montgomery partnered with Older Adults Technology Services, also known as OATS, to bring their award-winning technology instructional program to the county. This program offers free courses covering a range of topics, including technology basic skills, online shopping, bill payment, health and wellness, social engagement, and entrepreneurship. I know it's going to mess that word up. Before COVID-19, these programs were offered at libraries and recreation centers. In March, these programs were moved to Zoom. In the last quarter, over 4,000 people attended technology seminars. Later this year, Senior Planet Montgomery will partner with the Chinese Cultural and Community Center. Using Zoom, together we will pilot the offering of Senior Planet Montgomery 5- and 10-week training courses in Mandarin. If successful, multi-week classes will be offered in English and Spanish in January. Additionally, the county will continue to seek grant funding to support computers, home internet services, and training opportunities. Another program is Montgomery Connects. The county launched Montgomery Connects to provide free tech support and help through appointments for seniors. This program also offers program assistance for low-income families to sign up for Comcast, RCN, and Verizon. Staff from the county's Department Recreation COVID Corps are trained and managed by Senior Planet Montgomery and the Office of Broadband Programs. In addition to English, the support is available in several languages, including Spanish, Mandarin, Amharic, Farsi, French, Korean, Portuguese, and Russian. And there are also other languages. Team members can assist residents with questions, problems, or issues concerning their phones, computers, tablets, printers, email, using the internet or applications on the internet, and Zoom account setup and usage. Over 116 seniors were served in a 3-week period in August, and the program has been extended through at least October 31st. Montgomery County Public Schools. MCPS has leveraged federal and state COVID-19 stimulus funds, CARES Fund acting, to provide home internet wireless hotspots and Chromebook computers to all students that need them. During the last school year, MCPS provided 70,000 computers to students. These computers were upgraded over the summer. For the current school year, 100,000 computers have been distributed. Also, about 65,000 students use their own computers. MCPS has distributed 6,348 T-Mobile hotspots to students. Wi-Fi. The county is seeking to expand outdoor Wi-Fi expansion at our public libraries. Overall, the county's COVID-19 recovery efforts have focused on expanding outdoor Wi-Fi at libraries in neighborhoods with the largest number of underserved communities of color, in rural Poolsville, and in the libraries that had the highest participation in small business programs prior to COVID-19. Outdoor Wi-Fi is anticipated to be available at the Gaithersburg Library this month and available at Maggie Nightingale, Twinbrook, Almy, Aspen Hill, Germantown, Long Branch, White Oak, and Maryland Praisner in October. The libraries will be leveraging the outdoor Wi-Fi to provide library programming outside and will be promoting how to use the digital library resources from home and how to request curbside book pickup, which will be contact-free. A grant to provide outreach to nearby affordable housing communities was not funded. However, the Department of Technology Services is working with HOC and the libraries to expand awareness of the outdoor library Wi-Fi program. In addition, work is underway to expand capacity at Veterans Plaza outside of the Silver Spring Civic Building. Ag Reserve. The Office of Broadband Program has worked with Comcast and Verizon to expand broadband to specific portions of the Ag Reserve. Service has been extended to Mount Ephraim Road and Old 100 Road. The plan is to have mapping of areas not yet served by broadband providers released at the end of this month or early next month. We are also exploring the possible public-private partnership opportunities to expand access in the Ag Reserve. Similar to the Sugar Land Road project for Comcast, possibly we'll be able to do more with Comcast and or Verizon. The county will seek state funding this fall to expand our partnerships with Comcast and Verizon. Telegia, another company, has fixed wireless expansion in the Ag Reserve and are looking for additional opportunities. While they have had difficulty expanding in the Ag Reserve, the reason is because there is limited space available on existing tall structures, and also Comcast and Verizon are able to offer faster speeds. Furthermore, for underserved areas, we are looking to help less densely populated areas in the county. As you may know, the majority of our residents have access to at least 2 service providers, Comcast and Verizon. And in some cases, they have access to RCN. For many low-income residents of the county, the challenge is the lack of affordable, robust broadband services versus not having service at all, as is the challenge in the Ag Reserve. rural broadband. Our office conducted an initial field survey to determine Comcast and Verizon deployments in the Ag Reserve. We're also working with our congressional delegation to request that Verizon use its federal Connect American funds to complete construction ahead of the 2024 required completion date. OBP also intends to apply for Maryland and federal state grants this fall to extend fiber to approximately 365 addresses that do not have internet access at home. OBP has reached out to other wireless providers to see if any of these addresses can be completed. Verizon is continuing to build internet access in the Ag Reserve after having received some federal funding. Telagea, which I mentioned earlier, is also serving parts of rural Montgomery County. They are investigating the feasibility of installing their equipment on 2 existing cell towers that would enable them to serve more unserved locations in the Ag Reserve. Currently, Telagea has approximately 75 customers in the upper Montgomery County area, and now about a dozen scheduled for installation. Our latest project is Main Street Apartments Digital Equity Project. This information comes from a press announcement that was released earlier today. Montgomery County and nonprofit Main Street Connect announced a joint initiative that will offer low-income and special needs residents of the newly opened Main Street Apartments in Rockville access to free high-speed home internet. And as of today, the Office of Broadband Programs had completed 16 installs. This development was actually spearheaded by the parents of a young man who has developmental disabilities. They were hoping to alleviate similar situations for other families, so they started Mainstream Connect. The county executive said, affordable access to the internet is crucial, and the need for a safe and reliable connection is more important than it has ever been. With the help of our partners, we are excited to bring robust internet connectivity and home Wi-Fi to eligible residents of Main Street Apartments at absolutely no cost. We believe that the internet should be accessible for everyone, and we are happy to be working with Main Street Connect to offer it to their residents, many of whom depend on internet to work, learn, and grow. It is a pilot project that was put together with Montgomery County and Mainstream Connect with technology leaders Plume and Piscitron Access Solutions. Montgomery County will be providing symmetrical speeds as well as internet bandwidth. Plume, a leading smart home experience company, will provide an enhanced home Wi-Fi offering to residents free of charge. This service includes strong, consistent Wi-Fi coverage, online security, parental and access controls, and 24/7 customer service. Piscitron will be providing over in building or telephone pairs and is providing the necessary equipment. The pilot project will impact 60 to 70 units in the building. DTS is looking for ways to learn from this pilot project and develop additional opportunities to expand the availability of no-cost, low-cost internet solutions in the near future. We are currently discussing opportunities with MCPS to expand the Main Street Apartments model on a pilot basis to one or more affordable housing properties in Montgomery County. These things have not been identified yet, but we are working to find similar multiple dwelling units in the county, and it is in the very early stages. Again, thank you for the opportunity to talk about the broadband initiatives in the Office of Broadband Programs in the Department of Technology Services.
Thank you, Donna. We appreciate that information. Questions, we want to open it up for questions now. I'll scan the screen, or you want to enter a question into the chat room.
Can you talk a little bit about Ashburn and what you think that what happens when we get the fiber connection to Ashburn, what that leads to for community benefit?
Again, we believe, oops, I am unmuted. We believe that this will provide multiple opportunities for our residents. We talk a lot about our residents, but also anyone visiting the county. It is important for anyone, whether it's a business or a resident, who comes into this county to have access to high-speed internet.
We had someone wondering if there's a link to this information that we can add to the chat.
I can certainly provide the link to our website, and I will do that.
Is there, so we do have another question too. Is there any sense of why so few hotspots were provided by MCPS?
I cannot answer for MCPS.
Fair enough. And then there's a question of whether or not is the low income categorization based on farms. I would think that that's another MCPS question.
It's another MCPS question, yes.
Do you mind asking how does your office sort of connect or work with MCPS on these issues? I mean, I understand that they make some decisions around passing out computers or hotspots, but how do you work with them on that, or can you describe the connection, or is it completely separate?
There are our partners, and so we enter into conversations with them and provide whatever support we can.
Okay.
Could I follow up on that question? So as you just said that you have conversations with them, what do those conversations look like as it's related to broadband access for students who are currently in school virtually?
So we sit, and whatever issues are on the table, we talk about them. If there's some things that DTS can provide in terms of access on what we call FiberNet, we have conversations around that. There is something where a meeting where all of the chief information officers for not only MCPS, but WSSC, they all get together and they talk about issues and how we can work better together.
Could you give an example of what any initiatives or interventions that have occurred because of those conversations?
One thing is working together to provide computers if necessary, working to expand access if necessary. So it really depends on what the need is and how can we best work together to address it.
Thank you.
I have another question. Any idea when there might be an expansion of the seniors access program to other ethnic communities?
I do not have any idea. I wish I could answer that question other than to say we are working on it. As I mentioned, we do have some programs we're looking to expand programs in Spanish and looking at other languages.
How is your office educating residents on the use of technology, and are there any partners that you can name?
We are partnering with the Older Adults Technology Service. We are partnered with the Department of Recreation, and we certainly are willing to have a conversation with others who are interested.
I would also add, we do a couple other programs that I've become aware of with, for example, through our regional service centers, we do programs with older adults around the technology for filing taxes, for example. And so we'll help them with, you know, online tax filing and other things like that through direct education programs. And so for our older adults, we do a fair number of those kinds of activities as well, where it's module based or based on a specific online activity.
I see a question from Ms. Grant. We have talked about working with local churches to reach seniors. I do represent the Office of Broadband Programs in the Department of Technology Services. Comcast and Verizon continue to offer their low internet packages. Yes, we have explored ways to partner between seniors and high school students. Many of our COVID Corps team are high school students. Other questions, thoughts? Did I miss any, Elijah?
Yeah, there's the one question that we skipped over is what steps are you taking to ensure internet providers are doing what they can to support video conferencing that's in heavy use?
Our office can certainly have conversations about it, but as you may know, we work through our franchise agreements, and we're not able to regulate internet services, but we will have conversations about it. So,
Don, I think you said that is it true? I think Comcast, we are currently in discussions on the franchise agreement with, or one of them, correct? Or were we talking about the?
I did not state that. I did not.
Yeah, I mean, the franchise agreement process is the model by which we essentially come to agreements with the providers. And frankly, we leverage those to gain public benefit for things that are priority areas for the residents, for the county, things like that. And that is the mechanism by which we engender support for community initiatives.
But I will state that we are not in, I want to be clear, we're not in negotiation.
Okay.
Great. Another question is there anything being done to reach out to socially isolated seniors who don't have access?
We certainly do our best to reach everyone. I don't want to say that we're not, but I don't know that we're doing anything that is directed at socially isolated seniors. We are trying to communicate through the senior centers. We're promoting things on the internet. We're trying to connect. We're trying to connect with providers, caregivers. But if anybody has any ideas, please let us know.
Yeah, I would only say, and I see Raymond on the call, I know that so when we talk about socially isolated seniors, we have programs to outreach to them, just not specifically on the access issue. But there are a number of programs across county government, particularly within Health and Human Services and the Division of Aging and Disabilities, that does a lot of senior-based outreach. And I don't want to, yeah, I know Raymond would want to chime in. So I don't know that we do specifically broadband focus, but we have a number of programs that are targeted to reaching to otherwise isolated older adults.
And we are working with, I want to say her name is Odie. I might be.
Odile.
Odile. Thank you.
Yes, that was the piece I was going to chime in to add, is that we are working with DTS in doing some outreach to seniors. There is at least one program that I think we're using. I think the COVID Corps folks, there are actually some folks who are helping folks to understand access and how to do the simple things on the internet to give them access. And there was at least one program we had that one of our providers that we supported had up and running, where they were providing them with very simple tablets that did basic social media connections with between seniors. So there's been at least a couple of ways in which we've been keeping folks connected technologically, but also a lot of it is still the old-fashioned pick up the phone, make a call, make a connection, and engage folks over the phone, and a little less FaceTime with people, face-to-face contact, obviously, but and some of our seniors want that. They don't want the face-to-face contact, but they do want us to engage socially. So we've been doing a variety of different things, and DTS has been partner with ODEAL and Aging and Disabilities.
And I did mention Montgomery Connects, the program that.
Yes. Yeah.
So this is a binary question. Do your partners have data available regarding who they've been educating, demographic data in that regard? And do you have a timeline for when you will begin to translate information in order to reach out to non-English speaking communities?
Do not have data at this time other than the numbers that I mentioned in my presentation. And the timeline is beginning of 2021 to be able to reach the non-English speaking community, other than the things that I did mention that are available, the types of assistance and the languages that are available.
Another question / comment. So the MoCo Senior Planning Program has high school students helping Chinese seniors to learn computer skills. Are there other languages?
There are other languages that Montgomery Connects, and let me just get back to that page. If you just bear with me for a moment so that I don't list the languages incorrectly. In addition, this was, again, the languages are Spanish, Chinese, Mandarin, Amharic, Farsi, French, Hindi, Korean, Malayalam, Nepali, Portuguese, and Russian. That service is available, help is available.
Great, thank you.
And I will add the website to the chat box in a moment.
Right. Other questions? Looking for raised hands, anything in the chat box? Was that a hand raised, Julian? No, okay. I can see inside all of these little squares, trust me, folks. Okay. If there are no more questions, then we want to thank you, Donna, for joining us this evening and providing this information. Certainly, if there are any follow-up questions, we will make sure to reach out to you via email on behalf of the group and ask some of those questions and get some responses from you. But I think that's it. Looks like we've got it covered.
Okay, please reach out. I will also put my email in the chat box and my phone number if there are any other additional questions or concerns. And if I don't know the answer, I'll find the answer for you.
Perfect. Thank you. We appreciate it.
Thank you. Bye-bye.
Okay, folks, we're going to transition to our next topic, COVID testing. This evening, we have Dr. Raymond Kroll joining us, Chief of Health and Human Services here in Montgomery County, to go over COVID testing, as well as answer any questions you all have in that regard. Dr. Kroll?
So good evening, everyone. And actually, I think I'm expecting Dr. James Bridgers to be joining us to really lead this conversation off. But I will get started and share some information with you all to begin with. And I think probably I want to just start with a quick screen share and then talk to you a little bit about where we are where we've come in the last couple of months. Folks are aware I'm doing that, so I can make this work. I am a Teams person in the department, so we bounce between Teams and Zoom so often. You think I had this mastered, but I'm sad to say that would be a lie. So let me see if I can get this. I want to share this one, I think. Yes, okay. Now we push that up and push this up and go all the way back. I want to start there. I want to start here. Okay, so I know you all can see that, I assume. Safely, yes, Elijah? Okay, good. So I think the, I think Dr. Bridges is online with us here now, but so I'll go ahead and just start up and I'll turn it over to him. The folks know we had an amazing challenge about, I guess it must have been about 5 weeks or so now. Our primary testing source lab, Advogenics, it was issued a cease and desist order by the state and had to stop work, and that left us without a test supply. And so we ended up having to figure out how we recover from that. And that's been our process for the last several months of recovery. So I will skip this one and go here and talk to you a little bit about what you're seeing here. This is a summary of our total weekly testing coming into the end of August, just before the collapse of our testing relationship with Advogenics. And we were running upwards of about 5,000 tests a week, 4,000 to 5,000 tests a week, and had been ramping up for some time. That obviously knocked us for a loop. It didn't knock us completely out of the game. It just slowed us down. We did have some secondary sources that we've had in the game all along, but it left us without the use of saliva and saliva test kits that had become our primary way of doing broad scale public testing. So we dialed back and restarted. We had the state was in shutting down Advogenics, understood the predicament they had put us in, and so they gave us a 4-week emergency allocation with a lab called Cyan that they had been using across the state. And Cyan provided us with up to 5,000 tests a week so that we could continue the work. Took a little while to get that in play, but they also gave us 4 weeks to get a new contract in place with Cyan. And I'm happy to say that it took just under 4 weeks to get a new contract in place. And anybody who's done contracting with work with Montgomery County knows that by itself has been impressive. It has taken some time, but that one was one we had a rather do or die relationship with Cyan. So we're back up, and you'll see these numbers have been going up, and the numbers have been rising every week across the sites that we test in. And we basically, these are a couple of primary sources at this point. It is our primary testing sites, the Wheatons, White Oak, Plum Guard, the Civic Center, and it is also our ready responders. We have stopped doing pop-ups, which was another source of a variety of tests. So we put that on hold for a while until we could get our testing situation squared away. We're also continuing to look at other labs, so we expand our testing capacity. The number for 920 is actually higher than this shows. And the total number of tests across the county, I don't think I've got that slide with me tonight, is, yeah, here it is. This is countywide testing by all sources. So this is not just what Montgomery County is doing for testing, but that is testing from private providers, all doctors' offices, the hospitals, all sources from Montgomery County. And we were running about 20, 25, 26, 27,000 tests a week prior to our stall out. And we're now back up. We're still hovering around 20, 25,000 tests a week, 20, 24,000 tests a week. It's down from where it was in July and August, although, and I will say that it is down across the entire testing community. So private providers are seeing a drop, the state is seeing a drop, and I believe that the country is seeing a drop in testing as well. Just people not coming in to get tested. and we can maybe talk about that and speculate about that a little bit. But it has been a struggle to get the testing back up and running again. And I think the team has done a remarkable job of getting it back up, I will say. The other thing that is happening here is that, as you can see, going all the way back to April, and our surge and our high levels of positive rates by week has continued to decline until we're down to about, I think this is a week or so old, but in the 3.5% range of positivity at the end of every week. So that is a statement about where we are. This is what we look like from March when public schools closed, the day before public schools closed on March 15th, March 16th, until now, and where we are in terms of the case rate per 100,000 people. So, and this is Maryland data. And what you'll see, and I wanted to point this out to folks, March, the public schools closed on March 16th. Our rate per 100,000, memory serves me correctly, Earl will correct me if I'm wrong, or James will correct me if I'm wrong, was 4 per 100,000.
That's correct. That's correct.
Thank you, Doug. And now you'll see where the state is now at this rate. So it has been, as we start talking about reopening, you can see the numbers have not gone back to where they were pre-COVID. This is Montgomery County's rates. So the case rate per 100,000, and this is through September 17th. And you'll see where we were as 4 per 100,000, and now we're in the range of 8 per 100,000. A little better than the state is doing, but still, the takeaway message around this is that we are not out of the woods yet. And I think we've had a lot of conversations about how to message that to folks, that we've loosened some restrictions, but that does not mean that we are that we are safe and this virus is on a permanently declining trajectory. We are at the start of flu season, and that is adding a whole new set of worries and concerns for us all about how do we keep ourselves safe and keep the community safe, and at the same time allow some measure of freedom that we see in phase 2 of our reopening process in the county. So I think the last piece, I think this is not quite the last one. The last thing I will say about this is that we are, in addition to doing training, reestablishing testing at our permanent sites, Germantown, White Oak. We've added a CDC trailer at Lake Forest, where we're seeing a lot of drive-through volume. Folks are coming in consistently to that site, and we've reopened Silver Spring. We expect, and in addition to that, we have added the Latino Health Initiative Steering Executive Committee has begun testing in the Latino community, and the African American Health Initiative Executive Committee is gearing up to do similar thing in the African American Black community. This chart is population density for African American, Black or Hispanic residents, and the circles are places where we're testing. So, and the red is the density. The color is the relative density of positivity, of rates of positive cases. So you'll see that we are looking at testing in places where we're seeing the greatest impact of COVID-19. We're not done doing that expansion yet, but that is a continuing effort on our part. We stopped employee testing for the county until we could sort out the test kits and the test positive, the testing process. But I think we are working now to restart that, and we are working to figure out how and when we restart pop-ups. I'm going to stop there and not talk about this one particularly, and just turn it over to James. And if I can figure out how to kill my screen, I'll do that. I'll turn over to Dr. Stoddard. Dr. Bridgers. Sorry.
So thank you, Dr. Crowell. I think you summarized just about all the data points with the HHS Pulse. I see that my profile has been changed to my name and not your name, since I received the link later on. So just a couple of points I want to add, and then open it up for discussions and or questions. Regarding the case counts, today's surveillance report indicated that we had 54 cases for Montgomery County out of 344 cases for the state of Maryland, which is what you indicated early on, that the case counts are are slightly decreasing. However, we are not out of the woods by any shape, form, or fashion. We still see higher case rates in men and between the ages of 18 and 64, and our test positivity rate for those positive cases that that the state is reporting is slightly lower than their excuse me, 2.7 versus our 2.3%. You touched on the outdoor testing slash CDC trailers that have recently come online the last month. We've seen higher yields in our Lake Forest parking lot, Lake Forest Mall parking lot venue. Because it is new to the area, we're seeing a higher, but not as high as Lake Forest on our Randolph Road outdoor testing, because there were some questions about individuals' comfort level in going inside and being around individuals who may have been asymptomatic or symptomatic or just unsure of their COVID-19 status. And so we've increased our capacity, as you indicated. There was a challenge. We filled the gap. We didn't stop testing. We're actually seeing the counts, the projected number of tests slightly increase, but again, we need to do more. We're working with our public information office and our community comms team to increase and expand the messaging to get folks tested. The question came up earlier this morning on the council call, sitting as the Board of Health, whether or not we had the capacity. If you recall, we projected that we were going to expand up to 30,000 kits a week from HHS Public Health through our 3 testing tracks: our community testing track, our clinical testing track, and our symptomatic testing track. And so through those 3 tracks, employee testing track, and through those 3 tracks, we are increasing the capacity to return to that level of effort. However, we need information disseminated to the public. Let me just pause for a minute based on what the data is showing us as far as our contact tracers and what we're seeing as far as those high-risk gatherings and those high-risk locations. Those high-risk gatherings are family gatherings, house parties, and outdoor events. The high-risk locations are, again, those spaces and places where individuals work outside the home, where they have frequently gone to indoor shopping centers, malls, etc., and indoor dining. And they may not know that they are symptomatic and still are in the community. So again, we have the capacity, we have the testing venues, our outdoor testing venues, our indoor testing venues, which consist of Wheaton, Silver Spring, and White Oak, and we're working with Montgomery County Public Schools to have testing in Mid-County at Argyle Middle School, in Rockville at Richard Montgomery High School, Tacoma Park at Tacoma Park Middle School, and in Germantown at Kingsville Middle School. And so we are expanding our reach and our safety net web to get folks tested, but we want folks to know that if you frequently go outside the house and you aren't symptomatic and you're asymptomatic, you should consider testing in addition to those 3 top priority asks that we consistently and repeatedly say: mask up, wash your hands frequently, and maintain social distancing. I placed in the chat box our Montgomery County COVID testing link, which provides the information for our schedule through this Friday. We're working on the schedule for next week and into October. Also, if you aren't able to make an appointment online, you can most certainly contact our testing schedule helpline, 240-777-8255. 1755. And so we're looking at ways to continue to build upon our testing capability. Dr. Crowell mentioned that we are partnering and supporting our testing partners, such as the Latino Health Initiative, the African American Health Program, and the American Diversity Group. And we are supporting others upon request with our team. And if there are other questions about that, I can answer them later. But I wanted to just add those points in addition to Dr. Crowell's presentation from the data points that we tested. And so I'll stop there. And Dr. Crowell, if you don't have any other comments or input, we can open up to questions now.
Just to re-underscore, to rescore that as we move into flu season, I want to encourage folks more than ever to go get your flu shot this year. This is more important than it has perhaps ever been for us. And then the other piece is that as we move into flu season, we are going to be working to keep these numbers, to drive these numbers even lower if we can, but at minimum to keep these numbers down from resurging. The world right now is going through a second wave. Europe is going through a second wave of this, and part of the debate around this is whether or not is the reality that when they thought they were done, they weren't done. And that this bug is hard. This bug is highly contagious and transmits not just within 6 feet, but by aerosol. So it is a way more active critter than we thought it was. And I believe that if we're not careful, we will find ourselves back in the soup again. So we need to encourage folks to get tested, and not just if they're feeling symptomatic, but to get tested. If in any kind of way you think you've been exposed, and even if you haven't, getting tested will not hurt our capacity. It will not hurt you to get you or your family members tested. So I'll stop there and we'll see if we have any questions. Okay.
One point I wanted to add to that, looking at my notes, Dr. Crowell also mentioned that as we changed venues, vendors for our testing platform with Cyan Labs, we've been in communication with 13 labs to discuss multiple testing capabilities, from molecular tests, the AN tests, or the what were affectionately known as the spit kits, to the antibody tests, to the rapid tests / point of care. I know that the governor mentioned that he had secured about 250 rapid tests.
Yes.
Maryland Department of Health has been in contact with the local health officers, and they're still working through that distribution right now. They were informed that they've been pretty much earmarked for in clinical settings, nursing homes, and first responders. Additional information is forthcoming, and I'm sure either Dr. Crowell or Gales will provide an update to this body at a later date. But we've also looked at, in addition to expanding our testing capacity and venues, the types of tests that we're using, and I just wanted to share that with the group as well.
Thank you. I think that was the one thing that was floating in my head that I couldn't quite pin down. So thank you for covering that. James, there's a question in the chat, a couple of questions in the chat.
And I'll moderate that.
Oh, sorry.
Yeah.
Okay.
Don't worry.
I won't take your job from you, believe me.
No. You can have it.
I got a job. I'm good.
You got enough on your plate already. So, Dr. Bridgers, you had a link earlier. Can you post that link earlier?
Yeah, I put it back in there last.
Okay, appreciate it.
Yeah.
So the first question was whether or not someone who already has private health insurance, who went to go get a test through something like Kaiser Permanente, but didn't get the results of that test at that point in time, can go to one of the free county walk-up sites without worrying about the testing procedure that they went through utilizing their private insurance.
Absolutely. We are accepting all walk-ins, no questions asked, if you will. We're more focused on getting folks tested and to ensuring that we have zero transmission rates in the community.
Right. All right, folks. I know there's more than that question, so I'm watching the screen here.
Well, I have a question if you don't mind.
Go ahead. Mm-hmm. Go ahead.
Great. So first of all, thank you to both of you and your staff. Montgomery County's been doing a really great job on the public health front. My question is related to some of the contact tracing efforts that may be underway. And could you just speak a little bit about either coordination with other agencies on that, and just what the general uptake or at least ability to reach folks has been? I know that's been a significant issue for other contact tracers across the country in terms of the percentage of individuals that they can actually reach. So we'd love to hear more about Montgomery County's efforts on that.
Sure. So I don't have the report before me, but Montgomery County Health Department is working with the Maryland Department of Health to support the contact tracing effort. I'm going to see if I could find the slide, but just to generalize, it is successful. We're able to identify those high-risk gatherings, those high-risk locations, and the number of responses. I believe that as a result of the initial contact, individuals who have served as contact tracers have been able to make at least one initial contact upon their call. I'm going to see if I can find the data that can provide additional information around contact tracing. We have about 125 contact tracers in support of the 75 at the state, and then the numbers that we have for our local health department. So let me try to find that data. I hope that answers your question, but we have been successful. We've been able to reach 41,000 cases, 41,475 just at the data dashboard that I'm looking for as a reference point. So that's a significant number of cases that we've attempted for Montgomery County.
The other part of the contact tracing piece is that we do that in partnership with the state, and the state has a number of dedicated partners, dedicated contact tracers that they assign to work Montgomery County as well. So,
are you looking for the slide, or which slide are you looking for? The data on the graphs for the state on the contact tracing?
Yeah, that's it, Earl.
I'll write it up.
Okay.
John.
Just so the advisory group can get a snapshot of what the efforts are in those numbers of cases and those targets.
This is what you're looking for, right?
Yeah.
Yeah, so this shows the graph that we get. We essentially get these every Friday, I believe it is, Dr.
Yeah,
Gillis?
every Friday. Every Friday.
Yeah, that show from the previous period. Now, I will tell you, there are some things on this data that always raise questions, and Dr. Crowell and I talked about this before. A lot of the contact traces show like one or fewer contacts for people. I suspect that is not always a correct assessment, and so there's work to do in contact tracing. But this data, I think, is very valuable to us, and we get the same data for Montgomery County. We get a comparative data for Montgomery County and the rest of the state. So this actually helps us to assess where we're different from the state and where we're similar, because obviously we've taken a little bit of a different route to reopening things, and we will sometimes see that reflected in our data around, like we've seen a drop in indoor dining a little bit since the 10 p.m. alcohol change. It's come down about 3 percentage points, which again, going from 2017 is not an insubstantial amount, but
8 o'clock.
it's all right.
But this is the data we get every week.
Earl, is it possible for us to access this data or these documents, or are they for internal purposes?
I don't think it's impossible. I mean, I don't know what I don't think the state said that these are reports that we can put out, I believe. I know other jurisdictions utilize the graph.
Right. So let me just add to that. So one of the things that Dr. Crowell, at the request of the county executive, is to make these data more county specific. As you see, the date is 9/14. So we're looking to try to increase our capacity to get data that doesn't lag for a week. And so we're looking at creating a data dashboard that will be on site in Montgomery County at our COVID portal link, which would present a slightly more accurate picture of our contact tracing, the number of cases that we actually were able to contact versus the callback percentage rate and the number of hours that we have to try to, that the contact tracers are trying to reach individuals in a period of isolation and additional follow-up points. So we are working on a more robust and specified data dashboard that we will make available to the public.
I would also add the breakdowns that you see here have been relatively consistent over the last several months. And so we see a few percentage points one direction or the other, but these have been a pretty consistent story for the 6 weeks or so that we've been getting this data. We've seen a few, like I said, indoor dining has come down, I think maybe 3% in the time frame, but pretty consistent.
I think the other piece that I would add to this is because this is a clear indicator. Two things. This is a clear indicator of what the people are saying that where it's likely they got exposed in this process, and that family gathering and the work outside the home and indoor retail are really important pieces to pay attention to. The other thing that I think was implied in the question was about the contact tracing and sort of what people have seen in terms of challenges with contact tracing. And one of the challenges that I think exists is that there are people who because they regard it as a privacy issue, don't want to talk to contact tracers, and there are folks who are afraid to talk to contact tracers because it requires that you give them some information about where you've been and where you've gone, and they're concerned about where that information might get shared. So I would encourage folks in this group, and certainly as you go about the work and your business, to let folks know that contact tracing is purely a medical investigation into trying to catch and kill a disease. And that is what the information is used for, and their help will help us get this mess under control and back open sooner. So I want to.
I was going to add, we were talking about this a little bit earlier today, is we're trying to utilize some of this data to describe to people how frequently they should be tested. Meaning, if you're in some of these higher risk categories of activities, if you work outside the house, if you go to family gatherings, if you participate in indoor dining, you probably should be tested more frequently than if you don't do those activities, obviously. And so sharing this data is something we're looking to do, because then you can establish your own sort of personal profile of your risk factors, and then determine what you think the frequency of testing is for you.
Go ahead, John.
So I want to follow up on actually what was just said, because I feel like in some ways there's potentially mixed messages. Earl talked about the areas of risk, and that if you're in higher risk, you should get tested more frequently. And then I've heard from Dr. Crowd more than once talking about that everybody should be tested. And so I feel like that those are in some ways could be two different messages that people are hearing. That's my first question. Second question, actually, and I'm a novice, I don't understand exactly how the tests work. Could there be a time and place where doctors' offices are able to give out these tests for free, like a flu shot? Because to me, the ideal situation is you go get your flu shot, you get tested at the same time, as opposed to people having to do multiple things to get a test.
So two things. One is, and thank you for the question, and thank you for letting us asking it so we can clarify it a little bit. When I'm saying everybody gets tested, that's me being sort of thinking that there is a risk out in the community. Why wouldn't you, and you have an opportunity to get tested, get tested. There's a reality of some people who are working in higher risk occupations where they're exposed to the public, where folks who have been in social gatherings where people aren't well masked up. If you find yourself in that situation and you find yourself in those kind of spaces, you should definitely consider getting tested and getting tested more frequently. I live in the Kentlands area, and I walk this neighborhood all the time. And this morning, I was walking past a group of about 6 or 7 teenagers, adolescents. And they were sitting, hugged up and close to each other, exchanging phones with each other, no masks, and just, violating everything we try to teach a teenager not to do, they go and do, right? That's teenagers. But then they got up and went and got in their parents' car. So the parents were there and aware that they're not masked up and not concerned about it. But I'm thinking that the parents think they're perfectly safe. And they may well be, and 3 of the 5 kids may be perfectly safe. The other 2 may be one of the other 2 may be perfectly safe, but it only takes that one to create a problem in an environment that is generally fairly safe. And it's hard to tell when you're exposed or whether or not you might be exposed. So I think a periodic testing doesn't hurt. And if you are in a place where you're more frequently exposed and you have to be there, then I think that drives the message that Earl is giving you for greater frequency of testing.
Sure. And Dr. Crowd, just to add to that, personally speaking, I have a son who's a young adult. He's clearly out in the community, less partying, but if he goes to work and he comes back home, there's a higher risk for him to transmit the virus to someone in our household. And when my mother-in-law was living, she was 91, so she was at a greater risk. And so as more testing became available, we encouraged him to, get tested repeatedly. I travel from another county to work, and I may stop along those way, which fits into one of the questions that I see in the chat box. And as Dr. Stoddard indicated, that we see these data along the line of what we're actually seeing in the field. And so if I stop somewhere in between, or I stop in an area that may be a highly impacted zip code, I may put myself and others at the health department at risk. So I am tested often. And so when you look at those real-time phenomena as far as testing and what we're seeing across the data, we're actually applying the science to what we're doing and what we're seeing.
Just one quick follow-up, and I'm
Sure.
sorry to, but
That's all right.
I know for me personally, and maybe this was an error, when this all began, you heard about the limited number of tests available.
Yes.
And so I think that for me, myself, I'm not going to go get tested if I think there's a limited number of testing available and there are other people that you've mentioned that would benefit from test.
Mm-hmm.
The message you're saying now seems like that shouldn't be a worry for people, that there are plenty of tests available and that we should just go ahead and get testing. Is that correct?
Yes.
Okay.
Just for anecdotally, I think we had 800 and some odd test slots available today. How many, James, did we do today?
I didn't get the numbers yet. Let me see if they sent them in. I could tell you quickly, and they may have been slightly lower than what the projections have been. I don't have
several days over the last 2 weeks, we've had projections over 900 up to 1,000, and only gone 600, 650, 700 because we have more slots than we have people to take tests at this point. And so we are, and we were talking about like other avenues to get them out into the community, looking where people work, teachers and educators and staff at schools, for example, other things like that. And but still, we have community slots, drive-up slots that people have, that are there and are not being fully utilized.
I think that's right. So we're nowhere near hitting the ceiling on testing capacity, so people should not be worried about that. The other thing you asked, though, John, was about this issue of testing being combined in doctors' offices with flu shots, et cetera. Not there yet, but I do think that as we get a vaccine online, that'll become a part of a doctor's office visit at some point, and I suspect that as the rapid testing that was mentioned earlier becomes online and viable, that you may see that in the doctor's office on a more regular basis as well.
Great, thank you so much.
And John, one point to add, as Dr. Crowell indicated, one of the things that we're considering at HHS, PHS is increasing and expanding not only our COVID testing, but in these outdoor and indoor spaces, but principally outdoor spaces, that have immunization and vaccinations occur as well, and looking at the spacing for that. So we want to increase that capability as well.
Great, thank you.
Thanks. Another question that we have in the chat is, when is the turnaround time for the results for testing? Does it differ by site, or is it uniform?
It's uniform. Typically, we're seeing from initial tests, specimen collection to results reporting about 48 hours.
So let me just clarify that.
Yeah.
It's uniform for the county provided site.
For the county providers,
Yeah.
That's right. That's correct.
And the other uniformity question is that, James, I would ask, uniform across the board, uniform for positive results, because in terms of reporting.
Correct.
So we make sure that the positive results, we do, 700 tests in a day. And whatever the positive percentage is, the emphasis is on making sure that the folks who have had a positive test are contacted. The folks who had a negative test may get there may be a little bit longer lag in the results back. I, tested 2 weeks ago, and it took I got my result in 50 hours. I was clocking it. From the time I gave up the sample until I got it back, my wife's was about 6 or 7 hours behind. And that was towards the end of the day. So we're emphasizing getting immediate contact to folks that have positive results. We're also looking at some new systems that'll speed all of that process up. Looking at some automated email responses or result delivery for folks positive or negative. And as soon as we get that online, I think that'll speed us up. That'll speed us up even a little bit more.
Yeah, and I will say the state provides a report that tells us the turnaround time for all tests across the state. So we can also see where our vendor ranks relative to other vendors in the state. And looking at the report from the last report that I have here, most testing is a turnaround time in the 2 to 3 day range.
Mm-hmm.
There are a few that are 1 day, and there are a few that are more.
Mhm.
And the 25th and 75th percentiles are generally consistent, where it's 2 days or 3 days for most, just about across the board. And a few that are a bit more, a few that are a little quicker. But I think the vendor that we're currently utilizing falls really, really well in line with what the current average across the state, and frankly, probably across the country at this point is.
Thank you. And I do believe that the results of the test are not only given via the phone, but you also receive an email as well, correct?
Yeah, that's correct.
Pat, did you want to ask this question? Because you had 2 questions. Was the first data question answered, Pat? Did you get that answer?
No, I just want to know, and I'm sure the data may come from the state, but if it doesn't, if we have county data, is there a way to break it down by, race, ethnicity, gender, age, et cetera, all the things that would be helpful? That is the contact tracing data, or any of the data that's
And
not
so-
broken down.
And
That's
so
not
Dr. Lou, our chief epidemiologist, is working on the race, ethnicity data breakdown for not only the contact tracing, and he's working with our county stat folks so that they can be posted on the dashboard. So yes, we are breaking it down. It doesn't come that way from the state down to a localized level where we can see those patterns.
There are also, though, in the healthcare sector, a number of tests that do not have race data tied to them. They still a not insignificant amount. So we try to draw inferences from the pool that we do have, but it's not an insignificant number that do not have race data associated with them still.
And that would be helpful if we could get it,
Kirsten, was your question answered via the last part of this conversation we just had about being tested, even if you don't think you've had any exposure per se?
Kind of. I'd still love to hear it.
So the question is whether or not the test only shows current infection, right? And then the second part of that, is there a benefit to being tested if you don't feel that you've had any exposure whatsoever?
Well, in my opinion, based on the data that we talked about, contact tracing in those high-risk locations and those high-risk gatherings, if you aren't symptomatic and you don't go out as often, then there may not be a greater need to get a test. There's always a benefit to testing, especially if you go out, because you may be symptomatic and may not know it. And so the level of effort and the travel outside the home is what I suggest you determine whether or not you should be tested or be tested often.
I think the test does measure, the test we use does test for current positivity. But I would say that my response to that is pretty much the same as Dr. Bridgers, is that there's a judgment call around this. you know, I do a lot of moving around. So but I'm usually in a hypervigilant state, especially when I'm encountering people, because it's usually at a test site. I'm going through to see what's going on and to check in with the team on something. But the thing I would say to folks, so if you don't feel like you're being exposed, then I think you may, and you feel like you're being reasonably safe, then it's a judgment call about whether or not you feel like you should get tested. I would say that as time goes on, people tend to get a little less focused on their surroundings and will pay a little less attention with a little less anxiety and a little less vigilance. You know, I go to the grocery store 4 months ago and I'm looking at everybody and I'm circling around people to try to get to the bread. And I'm thinking about, has this bread been sneezed on? And those kinds of things. I go to the store now, I grab a loaf of bread and I bring it home, and I don't necessarily notice who's around me with and without. I may notice somebody without a mask, but I'm not looking at the quality. Is a you know, a hanky pulled up? I'm noticing a lot less. And there's always a tendency to the possibility of missing something in that process. And so that's maybe a reason to periodically get tested, just to be on the safe side. And if you can't really, if you feel like your vigilance is off and has slipped, and if you find yourself in a place where you unexpectedly, I walked Rio around the lake at Rio, and every once in a while I find myself look in a crowd of folks, and I'm aware, okay, who's wearing masks, who's not wearing masks, and how do I, you know, get clear and keep moving. So there's a judgment issue you have to make around that.
Thank you, Pat. That's what you're doing.
You know, on that note, Dr. Crowd, you know, it's really funny because I know a lot of people now are taking advantage of eating outdoors, and not to try to hamper that, but I also notice that they're trying to, you know, they're socializing more. So after they eat, they may stay around and socialize. Are there any reminders about, you know, put your mask back on if you are finished eating, but you still want to talk? You know, so I think, you know, not to get too lax, you know, as you sit outdoors, because I know in some shopping areas, you still walk past these folks who are sitting outside and are eating. So not to hamper the socializing, because I know people want to get out. So is there anything, you know, new messaging that we're going to get out to address some things like that?
Question. I don't know, Earl, James, what you all are thinking about this. I'm of a mind that you know, the restaurant rules tell people they should be masked up when they're not eating. You know, and I think those are the guidelines that we've put out and Dr. Gills has put out, and the team is tried to enforce. I know Dr. Stoddard's team and our licensing and regulatory teams make passes to say to restaurateurs, you have to remind people to mask back up. You can certainly socialize with a mask on. And so wearing a mask when you're not putting food in your mouth is I think good common sense and good judgment for folks. And we just need to be reminded to practice those rules.
Yeah, I think I wish we had been more specific when we first announced the mask. I think that was in part our mistake in the way we worded it. What you said at the table, we could have been more specific in the beginning. I think people have developed bad behavior. It's hard to go back, right? That's the finding. And so we do try and get out and do enforcement on this issue. We're visiting probably 25, 30 restaurants every single weekend to try and catch the dinner crew when they're busy. But obviously 25, 30 restaurants is not even 5% of the restaurants in Montgomery County every weekend. And so it's obviously, you know, a real challenge for us to be on top of. I think additional messaging is something we will look at and try and remind people. For sure. I mean, you know, we've been a little bit more cautious on even the restaurant opening. I know the governor moved to 75% on Monday. That's not something Montgomery County is interested in doing at this point. And obviously we put some restrictions on alcohol and other things like that as well to try and curb that. But obviously it's an area where we probably need to do more messaging, because I went to outdoor dining over the weekend in the Rio and Gaithersburg. And I can tell you right now, my family was probably the only table that I could see wearing a mask when we weren't actually eating food. And so I suspect that's a similar story in many restaurants across Montgomery County every day.
So, and just to add to that, I know that as Dr. Crowell indicated and Dr. Stoddard indicated, as far as our LNR and enforcement, a lot of the enforcement is combined with public health education and reminding folks of the necessity to wear a mask, especially if you're not eating. And we're pushing a lot of that. Clearly, Dr. Gales will do and has done public service announcements, or just even demonstrating, or, you know, Dr. Crowell and our team actually went to a restaurant and ate early on during the pandemic as a team to show that it was safe to eat in a Chinese restaurant. And so we're looking at innovative ways to show by practice those safeguards and those measures that we are employing folks to use and put in place.
I want to commend all of you all. You're doing a great job in keeping Montgomery County safe. Thank you.
We are testing and contact tracing and advising and talking to folks. It is every resident in this county is going to get us keep us collectively safe. But thank you, Pat. And I think the public health team has been phenomenal in their effort, and so has the emergency management support services team. So,
Marco, I'm going to come to you in a moment. I'm going to get to one question and I'll come right to you. There's a question of whether or not all testing sites are on board with the fact that anyone can get a test. There was a situation where a 28-year-old had difficulty getting a test and had to say he had traveled outside the county to get it. He works outside the home and lives with a 95-year-old grandmother in the same house.
So I wish I would have been made aware of that situation. All test sites, all staff are aware of the testing strategies in place. It's unfortunate that this 28-year-old had that experience, but we do welcome all walk-ups, unscheduled test requests, etc. I know that there was some challenges early on as far as when we talked about test and retest and folks who have been tested and had a negative test. There was a concern in another jurisdiction where an individual was trying to get a repeated test but couldn't get a test because that individual had traveled or hadn't been outside the county. Well, we haven't had that practice in place. And so if that individual or any individuals experience a similar situation, please contact 240-777-1755 and ask one of the supervisors to bring it to my attention or one of our team leaders' attention, and we can make the necessary adjustments upon request.
Yeah, I heard that. I saw that question a little differently and didn't think that it was in reference to a Montgomery County site. I hope not. If it was, that should be. It's clear that that should not be a problem with any of our Montgomery County run sites at this point.
Doris, did you want to touch up on that or clarify whether or not it was a Montgomery County site specifically?
Yes, it was in Gaithersburg.
What was a Montgomery County run site, one of our county run testing sites?
That I think so. I'm not sure, but I can verify that, but I'm not sure.
Okay.
Yeah, it may have been one of the other testing sites. We also, if you go to the link, there are other testing sites throughout the county that are not HHS Public Health Services testing sites, and we do provide those. It could have been one of those other sites.
Okay.
It's important to note that I think 90% of the testing that goes on in Montgomery County is not run by Montgomery County. We account for a very small portion of the actual total testing that goes on in the county.
8% to be exact.
8%.
Okay, that might explain it. Thank you.
You're welcome.
Marco.
Yes, this is mostly, I guess, question directed to, I guess, Dr. Crowell and I guess Dr. Stoddard too, because you were mentioning about restaurants. So I kind of just wanted to, go back to that a little bit. I had a question because I guess recently the parks playing voted to now, I guess, have alcohol in certain parks. And I don't know if the health department, if you guys are supporting that. I know it's certain parks. I'm just a little bit concerned just because some of the parks are located in areas where we're still getting a pretty good amount of COVID cases, like Wheaton, even Germantown, Silver Spring. So I know you guys said you guys were cracking down on alcohol, and I know we're supporting restaurants, but is it certain areas in the park? Do you guys know anything about that? Do you guys support the decision that was made to have the alcohol in these parks? Would that, you think the cases will go up? I'll just let you guys have the floor.
I can start probably. I don't think the county took a specific position on the Montgomery Parks ruling. Obviously, that's their board's ability to do so. I will say generally the outdoor spaces are substantially, probably in the order of 15 to 20 times more safe than indoor spaces based on data. So I think that generally speaking, having people, if they're going to physical distance and follow the rules in a park, is probably better than having them do it indoors with their friends in their home or in a restaurant for that matter. So I think that generally speaking, I would say that it's probably safer to do it in a park than elsewhere. And so obviously, we know certain behavior is going to happen. People are going to want to consume alcohol on a Friday or Saturday night. That is absolutely reasonable. And so finding safer avenues to do that is probably reasonable, so long as they can follow some basic precautions. Again, just because you're out with family and friends does not mean that everyone at that dinner table or everyone at that park are going to be safe for you to be around specifically. So obviously continue to follow the other guidelines, I think is what I would say.
Great. Is the funding for public testing such that any Maryland resident can test for free at any of the county or Baltimore city sites?
So I'll start, and Dr. Crowell can add, because most of this comes under his signature. I can only speak to the testing that we're doing from Montgomery County. Each jurisdiction has their own criteria for testing. And so what we do in Montgomery County may not be applicable or applied to Baltimore City or Baltimore County, or even Prince George's County. The local health department and government officials talk, and in some instances we share the same practice, but with a slight variation. And so I know that Dr. Gales is in communication, for example, with Anne Arundel County's health officer. And so some of the practices that we put in place, they've somewhat replicated some of those things as far as testing. So as specific to the county, based on the county appropriation and funds, either under the CARES Act or any other appropriation streams that we have. And so I'll leave Dr. Stoddard and Crowell to add to that, but that's pretty much what we've been guided to do.
Yeah, I mean, obviously many, not all testing vendors take insurance, which obviously helps with much of the testing costs. But obviously the county does pay for a number of tests, or anything that's not paid for via insurance, the county does pay for utilizing.
You faded out, Earl. I'm sorry. You broke, your voice faded out.
Yeah, so the county will pay for costs associated with tests that are not covered by insurance that are run through county-run sites. Now, obviously, there are testing venues that the county does not run, which will be based upon the individual location. Like I think CVS, they utilize the insurance, and then I don't know if you don't have insurance, I don't think they'll cover. You aren't eligible to go there in the same way. But the county-run sites, insurance or not, we're gonna age tested.
Correct.
Yeah. And if you have insurance, it will be useful to be able to bill that and cover some of the costs of the test. But that's, if you don't, then you don't. Yep. You still can get tested.
I just want to chime in. Sorry, this is Megan Green with the Office of the County Attorney. I just want to chime in really quickly. There's no statewide official agreement in place that has us covering other counties' residents, or more importantly, we can't say that if you go get tested somewhere in Baltimore City, that Baltimore City isn't going to bill you.
Yeah.
So I just want to make sure that that's clear.
What our attorney said, yes.
Exactly.
This is Lisa. I asked the original question. I'm more concerned about uninsured county residents who may live like on the PG border, and it might be more convenient for them to test in PG, or might work in Baltimore and might, during the week be able to test in Baltimore. So I'm just curious about those situations.
They would have to check with those jurisdictions to see what their policies are around payment for folks from outside of the county, and B, whether or not they're taking insurance or requiring insurance for the test.
I believe both Prince George's County and Baltimore City do cover uninsured as well, but obviously they would need to check the COVID websites for both of those jurisdictions. I think that's correct. Don't quote. I'm confident, but I'm not so confident that you should not check as well before you have someone go there.
Thank
At
you.
this time, I can tell you that our Montgomery County is paying for tests for uninsured Montgomery County residents. If a Montgomery County resident were to get tested in Prince George's County or Baltimore City, there is not currently any mechanism in place that has those other jurisdictions billing Montgomery County. Whether something like that is forthcoming, I can't say.
Okay. Thank you for that. Lisa, there's a question. Are kids able to be tested at public testing sites? So I guess we need to clarify kids. I have a 21-year-old. He's a kid to me.
I'm gonna tell him you said that, Elijah.
Yeah, he doesn't see himself as a kid, but I see him as a kid still. But yeah, are kids able to be tested?
Yes.
Yes.
Yeah, I don't think we have any we don't have any lower age threshold at all, do we? I think we.
No, I've seen. I don't know. I haven't seen infants being tested, but I have seen 2-year-old.
Yeah, I've seen toddlers being tested. Yeah.
All right, and a question from Peter. So county sites ask for insurance. I don't believe county sites are asking for insurance information, correct?
Not at this point.
Yeah, no, not at this point.
Right. Does that answer your question, Peter?
Dr. Crowell, are you certain about that?
Well, I'm certain 2 weeks ago when I went and got tested, they took a lot of information from me. None of that was insurance. So,
so with the previous vendor, we were asking for insurance information if the insurance information was available, but that didn't prevent the individual from receiving a test. With the current vendor, that's not one of the items on the self-report questionnaire.
So,
but generally speaking, I think just to be clear, even in places where we have with our testing vendor, if they try and bill insurance and insurance rejected it, the county would cover the delta of that cost. Just to be clear about the way it worked even previously, and so
that's correct.
There would be no circumstance where you would try to bill your insurance, it doesn't get covered, and you have to pay the out-of-pocket costs.
So, Jean, you're saying that the county website states that they will ask for insurance?
Yes, the link we were given earlier in the chat, it says on that link that it will ask you for your insurance.
So is that information that has not been updated since the provider or the vendor has been changed? I'm guessing, Dr. Bridgers.
So I need to check the website, Elijah, just to make sure. In some instances, I know that when we queried and or had conversations with the 13 lab providers that regarding their capability, we asked if they accepted insurance. So again, as Dr. Stoddard indicated, the county will offset the delta between the insurance. So it may be something that's still on the form, but I have a note to confirm that on the website. We've made some recent updates and changes, and so some information may be incorrect. So I apologize for that if that still exists.
So I do say, I went to the website and just took a look, and it says testing is free. If you have insurance, we will ask for your information, but there are no copays or deductibles around that, which means there's nothing that's out of pocket to you as someone getting tested. So just to be clear about that, I think the confusion is that at this point, when we do the actual, if you do make an appointment online, there's no point at which you're asked for your insurance information. So that may be something that might shift in our as we do future iterations of our online scheduling process.
Right.
But there will be no charge to a person out of pocket.
Right. The test is a swab test. Adam, you went last week to Wheaton. You want to just give us a couple of remarks about your experience being tested?
Yeah, so I probably went about 3 weeks ago. So this was after the vendors were switched, because I was planning on going I think the 1 week that it was unfortunately closed. But it was a really seamless process. It was very well staffed. I felt very safe. And it took me about 10 minutes total, and that includes filling out the paperwork, walking up, swabbing for the test, and leaving. So I think perhaps there's a perception that this could be a time suck for people, especially as you do need to make an appointment, but it was quite efficient. I was in and out of my door probably within 20 minutes total.
That's good to hear.
And just so we're clear about the swab, there are multiple different kinds of swab tests.
Yes.
One that I affectionately refer to as the brain scraper is the posterior nares test.
Yeah.
That goes really deep. We don't utilize those very often, and most of our county testing sites at this point are anterior nares, which is just the front of your nostril. Yeah. So just so you understand what you're getting when you come to a county testing site right now, it'll be an anterior nares, the front of your nose.
And we don't use the oral pharyngeal, the oral swabs either, where we stick the swabs down your throat. Let me just back up to the scheduler. The scheduler is set online so that we can do two things. We can gauge a projection so that we can have the number of kits available on site, since we change sites daily, and the fixed sites that we have currently are our Lake Forest CDC's trailer and our Randolph Road Bushy Drive. But it also allows us to have crowd control so that we can anticipate the number of staffing that we need, the type of support that we need as well. On the first day for Lake Forest, we projected 300 folks being tested, and it was well over that. Folks were actually lining up at 8:30, and I talked to Dr. Crowell, and we made the decision to open up early. So there is some level of unknown as we go to each site, depending upon the day, depending upon the time, or depending upon the location. And so that's why we have the scheduler. It allows us structure as far as identifying the number of tests we need and project the tests of folks for staffing.
Thanks, Dr. Britt. I actually did go to a site myself last week because my kid works outside the house. So I went with him as he got tested, and my experience was much like yours, Adam. It was really quick. 15 minutes, I stayed in my car. We filled out some information. Marjorie, they gave us the swab ourselves, and we've swabbed inside of our own noses and then put it inside of the tube and gave it back to them. But it was really seamless. I was not asked for my insurance information whatsoever. And I got my results back in 48 hours. Someone called me, and that call was followed up by an email. So I was very pleased with the experience. Marjorie, go ahead.
Yeah, sorry. Yeah, I just worry. I know of quite a few people that have gotten tested and have actually been positive, just because I have a lot of contact with the Latino community. And so there's a lot of, I guess they got tested early on and they were getting the brain scraper. So I've heard a lot of people say, oh, I would never, I'm not going back again, So I think it's important to let people know that it's not that more painful process. Because I myself, I have colleagues that have gotten tested and have complained, and they've said, oh, heck no. So that's kind of even deterred me from going. So I think it would probably be important to let people know that it's not, this more painful, or the perception is that it is more painful procedure.
Yeah, this is so less. I mean, and because you're self-administering, those first tests were done by clinicians, and they had to be medically administered. In part because you would probably never voluntarily go as far up towards your brain as a healthcare professional will go to get a sample. So these are much easier and self-administered. We could never do the volume of testing that we're trying to do with that kind of with a clinical team. We just don't have the staff to do it. So this is an easier test. And as we move towards hopefully in the near future, not too distant future, rapid results test and a variety of those, it might get even simpler. We just don't know yet. So we're
and early on, I remind the group that Dr. Gales was given 34 kits by the state. And so we've gone from 34 to 20, 30,000 plus. Yes. Yeah.
So circling back kind of to something that we touched upon earlier, just briefly, and Dr. Kroll, I'm not sure how comfortable you feel answering this, but does the health department support alcohol in the parks as the ruling currently stands? Someone would like to agree on that.
I'm sorry, you there's some static in the line. I can't hear you. I do not think that we have taken a position on this, Earl. I don't think the county's taken a position one way or the other on it.
I mean, honestly, it's not really. I mean, it's a different agency with a different governing board. In a lot of ways, not that dissimilar from MCPS, who reports to the Board of Education, as opposed to the Parks Commission Board can determine what's appropriate for the parks. I think I spoke generally on outdoor safe, things being safer outdoors and with space than indoors without space. So yeah, I don't think the county executives or the county executive branch has taken a formal position on it.
Yeah, anything else would be just my personal opinion about it.
Fair enough. Fair enough. Question here. So is there no option for the saliva/spit test? Is it all nasal swab at this point?
So one of the labs that we've been in communication has that capability. Our contracts management team is working with them regarding the contract. So that capability we anticipate will be back online once they work out the particulars that deal with the engagement, the lab, the turnaround, the pickup, the drop off, and the cost per kit. So yes, we are revisiting the spit kit, if you will.
Yeah, one of the lessons from our previous vendor experience was diversifying the portfolio of vendor options. Makes a lot of sense.
Yes.
Just to ensure that if there's an issue with one particular vendor, that you've got other options on the table. Obviously, when we negotiated our original contract early in the pandemic, the options were much more limited, and therefore now there are a number of companies and modalities that are available. And I think the exciting thing is really going to come over the next maybe month or so as the rapid testing world gets a lot more available, because that will offer us options. Like, for example, we'll be able to rapid test somebody and have contact tracers on site so that we can connect the positive results with the contact tracers in real time. And that will greatly increase the efficiency of the ability for us to do contact tracing that actually, minimizes exposures.
I would say, yeah, Adam. I would say to Adam's comment earlier about getting about the speed and of the test, the nasal pharyngeal test, the nasal anterior test using now is a much faster process than the saliva tube test we were using before we shifted away from advogenics. It's we will undoubtedly have a variety of different kinds of tests, but the speed and efficiency should play a factor in how we do large scale testing, especially. And to Earl's point, I think that the rapid results tests are going to revolutionize yet again what we're doing with testing once they're online.
And one of the labs that we've been in contact regarding the rapid test is also developing a platform for a phone application that will enhance the contact tracing capabilities, so you could be tested, be linked to a contact tracer, as well as have that app capability so that we can look at the exposure rate in any particular part of the county.
Great, thanks. Do we have any more questions?
I have one more question. Does Montgomery County utilize the tests provided by the state that Governor Hogan had acquired from South Korea? I read the Post article the other day in terms of the accuracy of those tests, and I know that those tests typically are focused in long-term care facilities. So just curious if we're utilizing our own vendor, the one similar to the county run test, or relying on those at all.
Adam, not to my knowledge, I don't think that the Montgomery County Public Health Services received any of those test kits. Not that any that Dr. Gale shared with me or Dr. Crowell or Dr. Stoddard. So
I don't think Montgomery County staff have ever seen one of those tests, let alone used them. I do believe that they were being utilized at some point to do some of the early nursing home testing through the National Guard when they were doing it. But I can't tell you whether they were used in Montgomery County or not, because that was being conducted by the National Guard, and I don't.
Yeah, and we were not aware of that. They were, as Dr. Stoddard said, they were exclusive to their strike teams, and we were not involved in that.
And for the rapid test that the governor's talked about, the 250,000 that they're working on acquiring through the multi-state collaboration, I don't think we're going to get those either. They will likely go direct to some of the nursing homes and other congregate venues as well. Obviously, we're interested in acquiring those independently as a county because they offer us a lot more. Like, for example, I think, even in terms of like schools, they offer a lot of opportunity in the educational venue to test faculty, staff, and students eventually as they become more readily available. And I think eventually, and I'm not sure whether this comes before a vaccine or not, because obviously the vaccine timelines are really up in the air. There probably will be over-the-counter testing available sooner or later. That will be an interesting day because obviously it's still a reportable illness. So I'm not sure. That'll be a very interesting day. Let's put it that way.
Thank you for that. Considering what we know about higher risk areas, is there any conversation along the lines of mobile vans bringing in testing to employees who work in higher risk areas such as construction sites, what have you, especially those folks who might be less likely to get tested?
I'm smiling.
I'm smiling too.
We're all grinning at each other because we've had this conversation at least twice in the last week and at least once today that I've had it. And the answer to that is that we are looking at engaging with the business community writ large to try to figure out how best to help support their recovery efforts and testing their employees and getting their employees tested would be part of that effort. And I would extend that to construction companies as well. Do we go to a site in the middle of the day and interrupt their work? Do we go at the start of the day, or do we meet them at some business central location and test groups of folks who are on their way to work? It's something we're still working out. But I think the answer is, yeah, we got to help the business community, and it's where we want to be where the people are. And
we also were approached today by the Soccerplex, the Maryland Soccerplex, about potentially utilizing that venue, but also their satellite ability to reach out to soccer players, which obviously the Latino community is heavily invested in soccer. And so that's a great modality as well for us to reach out, get younger people tested, which are an increasing percentage of our cases, and also just get into some of the, the soccer players, football players across the county.
And Dr. Crowell has also asked about those mobile vans to not only provide COVID-19 testing, but other HHS wraparound services that would have a broader reach as well to the community.
Thank you. Now you're doing my part of the job, James. So that's right. One of the things we discovered fairly early on was that folks who discovered, it became obvious fairly early on that folks that are coming in and get tested need some other things as well as the getting tested, food supplies, emergency cash assistance, and such. So we've now paired human service teams with a lot of our testing sites to make sure that folks know that resource is out there and we can connect them to it.
Excellent, thank you. Any more questions? Are you going to do flu shots also, given flu season is coming, or for high impact areas?
Already doing them. I mean, there's already been a clinic operating Dennis Avenue. I will note though that James and Ram, you know, I think it's like 1,000 or so vaccines that like maybe 1,000, a couple thousand. We don't get a ton that's provided to us by the state of Maryland. So we're obviously doing vaccinations, but the bulk of vaccination, just as the same as the bulk of testing for COVID-19, is done not by county government. It's done by healthcare providers. In the case of flu vaccine, your pharmacies and other places as well.
That's right. Yeah, it's I think it's a couple of thousand. James, you may know specifically.
Yeah, no, it's about 2,000. And what I don't know is if some of those that the vaccine I know separated from what we get for vaccine for children. And so a lot of that, as Earl indicated, comes from states. So we don't get a lot, and we are using them sooner rather than later now, even before flu season began. I think we began testing late August. So.
Thanks. Any more questions, folks? Okay, so besides Dennis Avenue, is there another spot, perhaps more closely situated to Up County?
I think right now Dennis Avenue is the primary spot. I know that we are going to expand immunizations to Rocking Horse, and we may do some flu shots there as well. But Dr. Gale,
correct? Like,
say again.
I know Joni was saying a few of the school-based health centers are being looked at for expansion.
Yeah.
Yes.
So Dr. Gales had that conversation this morning with Dr. McKnight and others from MCPS. So we are looking at that now, but that conversation just occurred this morning.
Great, thank you. Any more questions? How are we doing with childhood immunizations?
That's a great question. I know that they've increased. I haven't received any numbers yet to report up from Dr. Gales. We normally get a report on Wednesday regarding the status. And so I can provide kind of a snapshot of where we are after this call as follow up. So Elijah, I guess we could send it to you and you can disseminate it to the group.
Thank you. Elizabeth, you just came on screen. Did you want to ask something? No? Okay. All right. Any more questions, folks? Going once, going twice. All right. So, well, Dr. Bridgers and Dr. Crow, we appreciate your time this evening. We know that you are very busy dealing with this pandemic. We appreciate your efforts. Once again, a round of applause to the health department here and all of your efforts in doing everything that you can to keep us and our community safe. We appreciate you. Dr. Stoddard, we're just accustomed to you, so we take you for granted. But we know that you're a part of this.
Okay.
So we want to tell you we appreciate you.
I prefer to be, in the shadows. I think that's where
No, that's me. I'm the one in the shadows. So.
I think we're all in the shadows pushing someone else to the front.
Right, right. And though he's not here with us this evening, obviously we owe a debt of gratitude to Dr. Gales as well, too. Dr. Travis Gales for all of his work, continuing to push this forward. We are hoping that we get out of this, quote unquote, sooner than later somehow. But thanks to the precautions that you all have put in place, certainly you have saved many lives and kept a lot of people healthy. So thank you all for your time this evening. We appreciate it. Obviously, we'll get some information from you all to distribute to the group. If there are any follow-up questions we have, we'll make sure to reach out to you all to get those questions answered, and we will move from there. Folks, I believe our next meeting is scheduled for October 13th, correct, Adriana?
Yes, that's correct.
And we're still soliciting feedback on the topic, yes.
Yeah.
I know a few people have voted for things like mental health. Raymond, so putting that in your ear. I know
so I just want to register that if with any luck and with a little bit of grace and help from my colleagues, I will be out of the office that week.
Oh.
And trying to find a place where I can take a break where there is no cell tower. So, so
okay.
It's my target week for vacation if I can manage it. So that's my goal. So
okay. So maybe
I need to save the date then.
Yeah.
What's that?
So I need to save the date then.
Save the date, Jeff. Or I'll send some. I've got plenty of folks who can talk about mental health until you all pass out. So I don't think that'll be a problem.
Yeah, there are, so please do fill out the poll for what we're looking to discuss. Obviously, we want to keep, making sure we're having lively discussions like tonight, so.
Yeah. Thank you, Gene, for that idea, health impacts of social isolation, which I think fits in nicely to the mental health topic, right? For the next. Okay, and certainly share with us any ideas that you all have about that meeting on the 13th. I believe that's Tuesday. 13th is a Tuesday, correct?
Yes, Tuesday, that's 3 weeks from now.
Okay, at 7 p.m. So be on the lookout for Adriana's email, folks, with the save the date along with some other items. And once again, make sure to share with us any thoughts or ideas that you have about anything you'd like to add in addition to that agenda for that meeting.
So Dr. Wheeler, let me just say, along the front of mental health and exercise my psychology genes a little bit. Need you all to stay safe and take care of each other. This is a long run process and people are feeling afraid, I know, but diet, rest, get some nutrition, get some exercise, get some fresh air where you can, and stay connected to the people that are important to you. Are all things, and take a break from all of the lunacy that you see on the media and on the web, and including us. Stop talking to us on chats and et cetera. So stepping away from this is important to maintain your mental health and your physical health as well.
Thank you for that. That's true. Get some vitamin D while you can. Of course, while you do it, make sure to mask up. Continue to be safe. Keep distance, folks. But get as much exercise and those things. It seemed like it turned from summer to fall in one day this past week.
Really quickly. Frost warning this morning when I got up.
Exactly. So yeah, please continue to take care of yourselves. I want to thank again this evening Tina, Ryan, Ben, and Adriana for their work, and obviously Dr. Stoddard, the whole CRAG team here. We appreciate you all joining us, and we look forward to the next meeting.
Okay.
Take care, everyone.
Good night.
Great. Thank you.
Take care.